my name is Schnobrich. I'm one of the repro specialists here at Reproduction Equine Hospital, and today I'm just going to talk to you about some of the considerations for mares that you're considering for breeding that are 15 years or older. So the first thing we always tell clients is the most important thing, as reproduction is a luxury, is to have your mare in a good state of nutrition and health. The main things that we think about is as the horse is older, they have a higher propensity for inflammation, or inflammaging is a term you may hear with older mares. And we need to make sure that that's regulated because that can have a negative impact on fertility. So evaluating your mare with your veterinarian for metabolic diseases such as Cushing's or equine metabolic syndrome are very important in terms of establishing a baseline from which we can then build on her reproductive health. The next thing that's going to be really important is having a veterinarian examine your mare and have a breeding soundness exam performed. This may help you decide how viable it is for you to proceed with different types of breeding programs, whether you want your mare to carry the pregnancy herself, whether you want to place an embryo of hers into a recipient mare, or if she has such significant pathology, you may need to consider other options such as transvaginal oocyte aspiration and ICSI. So when we're looking at our older mare population, sometimes 15-year-old mares are able to carry a pregnancy with no problem, and this decision is based on that breeding soundness evaluation, which at a minimum should include a transrectal palpation, ultrasound, culture, and cytology, and potentially even a biopsy to ensure that the uterine health is appropriate. So that being said, the options available to brood mares, certainly just as in humans, senescence or the beginning of their reproductive tract to be less efficient or sort of shut down can occur at very different ages. And the ability of the mare to carry the pregnancy is probably the first thing that goes. So if a mare, for example, we want her to carry her own pregnancy, once she's no longer able to do that due to uterine pathologies such as endometrial cysts, fibrosis, or sometimes even severe inflammation and the inability to clear infections, we can then go to the next step of advanced reproductive techniques, which would include something like embryo transfer. And in that case, you're breeding the mare and flushing the embryo out of her uterus and putting it in a recipient mare. If that fails to work, let's say, for example, the mare has severe scar tissue or the uterine environment is so toxic that she can't even be bred and conceive on her own, we go to the next step, which is oocyte aspiration and ICSI. And this is a procedure that has been used very successfully in mares up to 24 years of age that may not even develop a dominant follicle for breeding. So what that procedure involves is taking the eggs out of the ovary, sending them to an IVF lab or in vitro fertilization laboratory where they will make the embryo, freeze it, and then we can put it into a recipient. So just because your mare is considered an aged mare, there are many reproductive options that are available to you, and it's important to understand what's going to be the best fit for your mare and the most efficient. So I hope that you'll speak with reproductive specialists or veterinarians to find out what's available to you, and I hope that's helpful.